Before you take one more walk, count one more step, or blame your age for cold feet and heavy legs, stop and look down. Do your feet feel cold even when the room is warm? Do your socks leave deep rings around your ankles at night? Do your calves feel tight, tired, or strangely heavy after only a few minutes of standing? And when you rise from a chair, do your legs sometimes hesitate, as though they need a moment to remember how to support you? Most adults over 60 hear the same advice again and again: walk more. Walking is important. It supports your heart, lungs, mood, muscles, and independence. But here is the eye-opening truth many people never hear. You can walk every day and still fail to fully activate one of the most important pumping systems in your lower legs. That may be why some people take thousands of steps, elevate their feet, drink more water, and even wear compression socks. Yet their ankles still swell, their feet stay cold, and their legs continue to feel weak. The problem may not be laziness. The problem may be that the natural pump hidden inside your calves is no longer squeezing as strongly as it once did. Doctors and rehabilitation specialists often describe the calf muscle pump as a kind of second heart. It does not beat in your chest. You cannot hear it. Most people do not even know it exists. But every time your calf muscles tighten correctly, they help push blood upward from your feet and ankles, working against gravity. When that pumping action becomes weak, blood may linger in the lower legs. Your feet can feel colder, your ankles may appear puffy, your calves may become heavy, your balance may feel less reliable. Then discomfort makes you move less, and moving less can weaken the pump even further. That is how a small change can quietly become a frustrating cycle. A 72-year-old man named Robert noticed this happening after retirement. He still walked around his neighborhood most mornings, so he assumed his legs were getting enough exercise. But by late afternoon, his socks left deep marks. His feet felt cold, and he had started using both hands to push himself out of his favorite chair. He thought it was simply old age. Then a physical therapist asked him a surprising question. "When you walk, do you still push strongly through your toes?" Robert did not know. Like many older adults, his steps had gradually become shorter. His heels barely lifted. He was walking, but his calves were not completing a strong contraction. He had movement, but not enough deliberate pumping. After adding a few slow, supported exercises to his normal walking routine, he began to notice small but meaningful changes. His ankles felt less stiff in the morning. His calves felt more active. He stood from the chair with more confidence. The movements were not magic. They did not replace medical care. They simply trained muscles and positions that ordinary walking was no longer challenging fully. In this video, you will learn 5 simple leg movements that may help activate the calf pump, strengthen the muscles that support circulation, and improve steadiness after 60. We will count down from number 5 to number 1. Each movement prepares your body for the next, and the final movement includes one tiny detail most people skip, a detail that changes an ordinary heel raise into a much more deliberate calf pump exercise. Stay until number 1, because it may look familiar at first, but once you understand the correct hold, the slow release, and the foot position, you will never perform it the same way again. Before we begin, you need to understand why your lower legs may need a second heart in the first place. Why blood has a harder journey from your feet. Your heart pumps oxygen-rich blood outward through the arteries. That blood travels down through your hips, thighs, knees, calves, ankles, and feet, delivering oxygen and nutrients to the tissues. But after reaching the lower body, the blood faces a difficult return journey. It must travel upward, and gravity is pulling it in the opposite direction. Your body solves this problem through a coordinated system. Veins carry blood back toward the heart. Tiny one-way valves inside many leg veins help prevent backward flow. At the same time, the muscles in your feet and calves squeeze those veins when you move. Imagine gently pressing a tube of toothpaste from the bottom upward. The pressure moves the contents higher. Your calf muscles perform a similar mechanical job. When they contract, they compress deeper veins in the lower leg and help move blood upward. When the muscles relax, the veins refill. Then the next contraction pushes again. Contract, release, refill, push. That repeated action is the calf muscle pump. It is one reason your calves are sometimes called your second heart. When you are younger, active, and moving through a full range of motion, this system may work without attracting your attention. But after 60, several common changes can reduce how effectively it operates. The calf muscles may become smaller or weaker. The ankles may become stiff. Long periods of sitting may keep the pump inactive for hours. Pain in the knees, hips, feet, or back may shorten each step. Fear of falling may cause you to shuffle. Your heel may not rise as high, and you may stop pushing firmly through the toes at the end of each step. This is important because walking is not just about moving the legs forward. A strong step normally ends with a push-off. The heel rises, the calf contracts, and the body moves forward. But when steps become short and cautious, that final squeeze may become smaller. You may still be walking, you may still be counting steps, but the calf pump may only be receiving a partial contraction. That is why walk more is not always the complete answer. Walking remains one of the best forms of daily activity for many older adults. The movements in this video are not meant to replace it. They are designed to target the muscles, pauses, holds, and ranges of motion that everyday walking may miss. However, there is an important warning. Cold feet, swelling, leg pain, and weakness are not always caused by inactivity or weak muscles. These symptoms can also be connected to artery disease, vein problems, diabetes, nerve damage, heart conditions, medication side effects, or other medical issues. Sudden one-sided swelling, severe pain, a pale or blue foot, sudden numbness, chest pain, breathing difficulty, or a leg that becomes unusually cold requires urgent medical attention. These exercises are for gradual weakness, stiffness, mild heaviness, and reduced activity, not for a sudden emergency. Speak with a qualified healthcare professional before starting a new exercise routine if you have a history of blood clots, serious heart disease, diagnosed circulation problems, recent surgery, severe joint pain, or major balance difficulties. Now let us begin with the easiest movement on the list. It looks almost too simple to matter, but when performed slowly, it can switch the lower leg pump back on without requiring you to stand. Number 5. The slow ankle pump. Imagine sitting for an hour. Perhaps you are watching television, reading, traveling as a passenger, working at a desk, or waiting at a clinic. Your thighs are supported by the chair. Your feet are still. Your ankles are barely moving. Your calf muscles are mostly relaxed. Blood continues to circulate, but the extra muscular assistance that normally helps move it upward has slowed. This is where the ankle pump becomes useful. Ankle pumps are often used in rehabilitation and recovery settings because they can activate lower leg muscles while a person remains seated. They are especially helpful for someone who feels tired, unsteady, or uncomfortable standing for long periods. But here is the mistake most people make. They rush. They flap their feet quickly up and down using a shallow, loose motion. The toes move, but the calf barely tightens. It looks like exercise, yet the target muscles receive only a weak signal. The purpose is not to wiggle your feet. The purpose is to create a slow pump and release cycle. Sit tall in a sturdy chair. Place both feet flat on the floor, about hip width apart. Keep your heels planted. Now slowly lift your toes toward your shins. Do not jerk. Pull the front of each foot upward until you feel the muscles along the front of your lower legs working. Pause for 1 second, then lower the toes. Next, press the balls of your feet into the floor and slowly raise your heels. Rise as high as is comfortable without rolling your ankles outward. At the top, pause again and feel the calves tighten. Then lower your heels with control. That is one complete repetition. Toes up, pause. Heels up, pause. Lower slowly. Begin with 20 controlled repetitions. Rest if needed. You may repeat 1 or 2 additional sets during the day, especially after long periods of sitting. Another version can be performed with your legs extended slightly forward. Point your toes away, then pull them back toward your body. Move through the largest comfortable range without forcing the joints. Why does this simple movement matter? When your heels rise, your calf muscles shorten and tighten. That contraction may help squeeze the veins inside the lower leg. When the heels lower and the muscles relax, the system refills for the next repetition. It is a rhythm: squeeze, release, squeeze, release. You are deliberately reminding the lower leg muscles to do their pumping job. This movement is also easy to attach to a daily habit. Perform ankle pumps while the kettle heats. Do them during television commercials. Complete a set after each meal. Use them before standing after a long car ride. The easier an exercise is to remember, the more likely you are to repeat it consistently. Some people notice a mild feeling of warmth in the feet or gentle fatigue in the calves. That usually means the muscles are working. Stop if you experience sharp pain, unusual dizziness, severe cramping, or a sudden change in symptoms. The ankle pump awakens the lower leg system, but it does not strongly challenge the larger muscles that help you stand, climb stairs, and control your knees. That brings us to number 4. Number 4. The controlled seated leg extension. Many people think leg circulation is only about the feet and calves, but your blood must also travel through the knees, thighs, and hips. And the large muscles at the front of the thigh, the quadriceps, play a major role in mobility and independence. They help you stand from a chair. They control your body when you sit down. They support the knee while climbing stairs. They help prevent your legs from collapsing when your balance shifts suddenly. After 60, these muscles can weaken quietly. At first, you may not notice. Then you start pushing harder with your hands to stand. Low chairs become uncomfortable. Stairs feel steeper. You hesitate before stepping off a curb. You avoid kneeling because you are unsure whether you can get back up. This slow decline matters because leg strength affects more than exercise. It affects how safely and confidently you move through everyday life. The seated leg extension is a simple way to train the front of the thigh without requiring you to balance on your feet. Sit in a stable chair with your back supported. Place both feet flat on the floor. Keep your chest lifted and your abdomen gently firm. Do not lean backward or swing your body. Now slowly straighten your right knee, lifting the foot forward. You do not need to lock the knee or force the leg perfectly straight. Move only through a comfortable range. When the leg reaches the highest safe position, tighten the front of your thigh. Hold for 2 to 3 seconds, then lower your foot slowly. Do not let it drop. Complete 10 to 15 repetitions, then switch sides. Begin with 1 set. As your control improves, you may gradually work toward 2 sets. The most important part is not how high you lift the leg, it is how slowly you control it. Many people kick the foot upward and let gravity pull it back down. Momentum does most of the work, and the thigh receives less benefit. Instead, move slowly enough that you could stop halfway at any moment. Lift, tighten, hold, lower. That controlled lowering phase keeps the muscle active as it lengthens, and may help build strength more effectively than a quick, careless movement. Keep your back against the chair. If your body rocks backward every time the leg rises, reduce the height. If your hip pinches, shorten the range. If you feel sharp pain inside the knee, stop and seek professional guidance. You should feel firm tension or mild fatigue across the front of the thigh, not stabbing pain. Once the movement becomes easy, some people add a very light ankle weight or resistance band. But more resistance is not automatically better. Perfect control matters more than heavier weight. You can also perform an isometric version. Straighten the leg to a comfortable position. Hold it still for 5 seconds while breathing normally. Then lower and rest. This can be useful when repeated bending and straightening feels uncomfortable. Why is this exercise included in a circulation-focused routine? Because the muscles of the thighs also contract around blood vessels, and stronger thighs make standing and walking easier. When standing feels easier, you are more likely to stay active. When you remain active, the entire leg pump system receives more regular stimulation. This movement builds the strength needed to rise. But circulation and independence require more than thigh strength. Your calves and ankles must also produce force while you are standing. That is where number 3 becomes powerful. Number 3, the supported calf raise. This is the movement where many people finally feel their second heart working. Stand behind a heavy chair that will not slide, or face a stable kitchen counter. Place your hands lightly on the support. Your feet should be about hip-width apart. Point your toes forward or only slightly outward. Before lifting your heels, stand tall. Imagine the top of your head being lifted gently toward the ceiling. Keep your knees soft, not locked. Look straight ahead. Now press through the balls of both feet and slowly lift your heels. Rise only as high as you can while keeping the ankles steady. Do not let them roll outward. Do not allow your feet to collapse inward. At the top, pause for 2 seconds. Feel both calves tighten. Then lower your heels slowly for a count of 3. 1, 2, 3. That is 1 repetition. Begin with 8 to 10 repetitions. As the exercise becomes easier, gradually work toward 15 or 20. The pause at the top and the slow lowering are what make this exercise effective. When people bounce rapidly, momentum carries the body. The calf tightens only briefly and ankle control is reduced. But when you rise slowly, hold, and lower with control, the calf remains under tension longer. The ankles must stabilize. The foot must press evenly into the floor. This trains circulation, support, strength, and balance at the same time. Think about what happens when you stumble. Your body does not give you time to prepare. Your weight shifts suddenly. The ankle must stiffen, the calf must contract, the foot must push into the ground. The nervous system must react quickly enough to keep you upright. A supported calf raise practices many of these actions in a safe environment. 3 details make the movement much better. First, distribute pressure across the whole front of each foot. Do not roll only onto the little toe side. Keep pressure near the base of the big toe as well. Second, make sure the knees point in the same direction as the toes. Do not allow them to collapse inward. Third, use the chair or counter for balance, not for lifting. Your hands should not pull your body upward. The calves should perform the work. You may notice that one heel rises higher than the other. Do not panic. One calf may be weaker, one ankle may be stiffer. A previous injury may have changed how you distribute weight. Use the difference as information, not as a reason to force the weaker side. Move within a safe range and focus on smooth control. If standing calf raises are too difficult, perform them while seated. Sit tall. Press the balls of your feet into the floor. Raise both heels. Pause, then lower slowly. You can place your hands gently on your thighs for a small amount of resistance, but do not push down aggressively. As you improve, make the exercise harder by increasing the hold at the top or slowing the lowering phase. You do not need a dangerous variation, you need better control. Many older adults begin to feel more secure after practicing supported calf raises consistently. That is not because the movement creates instant results. It is because the calves and ankles are repeatedly learning to produce force while the body remains upright. However, strong calves alone are not enough. During walking, your entire body repeatedly balances on one leg for brief moments. If you cannot control your weight on one side, confidence decreases and activity often decreases with it. That is why number 2 may reveal more about your mobility than you expect. Number 2. The supported single leg stance. At first, this looks like a balance test. But the moment one foot leaves the floor, nearly every stabilizing muscle in the standing leg must wake up. The foot presses into the ground. The ankle makes tiny corrections. The calf tightens. The hip muscles engage. The abdomen braces. The eyes, inner ear, joints, and nervous system exchange information rapidly to keep you upright. Instead of one quick squeeze, the standing leg creates a longer, continuous contraction. This makes the movement useful for balance, muscular endurance, and confidence. Stand beside a stable kitchen counter. Place both hands on it. Shift your weight slowly onto your right leg. Lift your left foot only 1 or 2 inches from the floor. Do not raise the knee high. The goal is stability, not height. Keep the standing knee slightly soft. Keep your hips level. Look straight ahead at a fixed point. Hold for 10 seconds while breathing normally. Then lower the foot. Switch sides. Complete 2 rounds on each leg. As you improve, increase the hold gradually to 15, 20, or 30 seconds. You can also reduce the amount of hand support in stages. Begin with 2 hands, then 1 hand, then 2 fingertips, then 1 fingertip. Eventually, you may hover your hand just above the counter, but only when you can remain steady and the support is close enough to catch you. Do not close your eyes. Do not stand on a pillow. Do not move far away from the counter. Those variations increase risk and are unnecessary for most people. There is another common mistake: clawing the floor with the toes. When people are afraid of falling, they sometimes curl their toes tightly into the ground. This creates tension and can cause foot cramps. Instead, spread your toes gently and imagine your whole foot becoming a wide, stable base. Also, keep breathing. Holding your breath can make you feel tense or dizzy. Breathe in slowly. Breathe out slowly. Allow your ankle to make small, natural adjustments. You may discover that one side is much easier. That is common. Previous injuries, arthritis, stiffness, weakness, vision changes, or habitual posture can create differences between sides. Train both legs, but do not force the weaker side to match immediately. A safe 10-second hold is better than a dangerous 30-second struggle. Why does this matter for circulation? Because the muscles of the standing leg remain active for longer than they do during one normal step. The calf, ankle, foot, and hip continue working to hold your body steady. More importantly, improved balance can increase confidence. A person who trusts their legs is more likely to walk, stand, and move through the day. A person who fears falling often sits more, and long periods of sitting reduce the repeated muscular contractions that support blood return from the legs. So, balance and circulation are not separate problems. They often influence each other. Now we reach number 1. It looks like a calf raise, but one small change turns it into a much more deliberate pumping movement. Number 1. The standing calf pump hold. At first glance, this exercise appears identical to number 3. You stand, you lift your heels, your calves tighten. But there is one crucial difference. You remain at the top long enough to create a sustained, controlled squeeze. The goal is not to complete as many repetitions as possible. The goal is to reach your highest comfortable position, hold it without losing alignment, continue breathing, and lower slowly. Stand behind a sturdy chair or at a stable counter. Place your feet hip-width apart. Keep the toes pointing forward. Rest your hands lightly on the support. Rise slowly onto the balls of your feet. At the highest comfortable point, stop. Now hold. 1, 2, 3, 4, 5. Keep breathing. Keep your eyes forward. Keep pressure across both sides of the front of each foot. Do not roll your ankles outward. Feel the calves working like firm pressure chambers around the veins of the lower legs. Then lower your heels slowly for 3 seconds. 1, 2, 3. Do not drop. Rest briefly at the bottom, then repeat. Begin with 6 to 8 repetitions. If that feels comfortable, progress to 10. Over several weeks, you may work toward 15 controlled repetitions. The hold is the center of the exercise. Without it, many people bounce through heel raises using momentum. With the hold, the calves remain contracted for longer. The ankles must stabilize. The feet must stay aligned. The nervous system must maintain control while the muscles remain under tension. This is why speed is not your friend here. Faster is not better. Higher is not always better. A smaller heel lift with excellent alignment and a steady 5-second hold may be more useful than a high, shaky rise that lasts less than a second. Avoid these common errors. Do not lean your body over the counter. Do not bend and straighten your knees to create momentum. Do not roll onto the outside edges of your feet. Do not hold your breath. Do not force the heels higher when the calves begin to cramp. The movement should feel strong and controlled, not desperate. If you cannot hold for 3 seconds, begin with 1 second. If standing feels unsafe, perform a seated heel raise with a pause at the top. Progress is not measured by copying someone else. It is measured by performing a safe version today and gradually improving your control. Why might this movement be especially important for someone who already walks every day? Because normal walking creates short bursts of calf activity. But many older adults no longer complete a strong push-off at the end of each step. Their heel barely rises, their stride becomes shorter, their calf contracts only partially. They are walking, but the strongest part of the pump may be missing. The calf pump hold restores that deliberate squeeze. It teaches your body to rise, stabilize, maintain pressure, and release slowly. That is the detail Robert had been missing. He did not need to stop walking. He needed to add a movement that reminded his calves how to complete the job. How to combine all 5 movements. Knowing 5 exercises is helpful, but random exercises are easy to forget. A simple sequence makes them easier to use consistently. Here is a routine that may take approximately 10 to 15 minutes, depending on your pace and rest periods. Begin seated. Perform 20 slow ankle pumps. Lift the toes, pause. Raise the heels, pause. Lower with control. Next, complete 10 seated leg extensions on each side. Lift slowly. Tighten the thigh. Hold for 2 seconds. Lower without dropping. Then stand at a stable counter. Perform 10 supported calf raises. Pause briefly at the top and lower for 3 seconds. Next, practice the supported single leg stance. Hold for 10 to 15 seconds on each side. Repeat twice. Finish with 6 to 8 calf pump holds. Rise slowly. Hold the top position for 3 to 5 seconds. Lower for 3 seconds. Rest whenever necessary. You do not need to perform every repetition perfectly on the first day. Use more hand support. Reduce the number of repetitions. Shorten the holds. Work within a comfortable range. Consistency is more valuable than intensity. A practical schedule is to perform the full routine 3 to 5 days per week, while continuing your normal walking and daily activity, provided a healthcare professional has not told you otherwise. Ankle pumps may be performed more often during long periods of sitting. The goal is not to exhaust your legs. The goal is to remind the muscles, veins, joints, and nervous system to work together. What results should you expect? Be careful with anyone who promises that cold feet, swelling, or circulation problems will disappear overnight. Bodies rarely change that quickly, especially when symptoms have developed over years. Early improvements may be subtle. Your feet may feel warmer for a short time after the routine. Your ankles may feel less stiff in the morning. You may stand from a chair with less hesitation. You may grip the counter less tightly. You may lower your heels more slowly. Your calves may feel stronger on stairs. You may feel more confident during a walk. These functional changes matter. Instead of judging progress by one symptom, ask better questions. Can I perform more controlled repetitions than last week? Can I hold the balanced position with less support? Can I rise higher without rolling my ankles? Can I lower my heels more slowly? Can I stand from a chair with less help from my hands? Can I walk at a comfortable pace without feeling as heavy or uncertain? These are meaningful signs that your strength and control may be improving. Results vary. The cause of your symptoms matters, your medications matter, your activity level matters, the health of your arteries, veins, nerves, joints, and heart matters. That is why exercise should support proper medical care, not replace it. When you should not rely on exercise. This warning may be more important than every movement in the video. Do not assume all leg symptoms come from weak muscles or aging. Seek urgent medical care if one leg suddenly becomes very painful, pale, blue, numb, weak, or unusually cold. Sudden one-sided swelling, warmth, or redness may require immediate evaluation. Chest pain, faintness, or difficulty breathing with leg swelling is an emergency. A wound on the foot or ankle that does not heal should be examined by a healthcare professional. So should blackened skin, drainage, increasing redness, severe nighttime foot pain, or repeated calf pain that appears during walking and improves with rest. People with diabetes may have reduced sensation and may not notice a small injury. Check your feet regularly. Look around the heels, look between the toes, check the soles. A small blister, crack, or cut can become sensation or blood flow is reduced. New or worsening swelling also deserves medical attention, especially when it affects mainly one side or appears with shortness of breath. These movements are supportive tools. They are not a diagnosis. They are not a treatment for a blood clot, blocked artery, serious infection, or heart problem. The 4 mistakes that keep legs weak. The first mistake is waiting for motivation. Many people imagine they need a perfect 30-minute workout, expensive shoes, resistance machines, a gym membership, or a burst of energy, so they delay. But your calf pump responds to muscular contractions, conditions, not perfect conditions. 20 ankle pumps while seated. 10 leg extensions after breakfast. A few slow heel raises at the kitchen counter. A supported balance hold while waiting for the microwave. 5 calf pump holds before dinner. Small movements become powerful habits when they are repeated. The second mistake is rushing. Fast repetitions often feel easier because momentum carries the body. Slow repetitions expose the muscles. That is exactly what you want. A clear contraction, a controlled hold, a steady release. The third mistake is ignoring safety. Keep support close. Use a chair that will not slide. Stand on a non-slip surface. Wear secure footwear when appropriate. Stop if you feel dizzy. Never push through sharp pain. The fourth mistake is treating walking and strengthening as competitors. They are partners. Walking supports endurance, cardiovascular health, mood, and daily independence. Targeted movements strengthen the specific muscles and positions that ordinary walking may no longer challenge fully. One does not replace the other. Together, they create a more complete approach. Final countdown. Let us bring everything together. Number 5 is the slow ankle pump. It is an easy way to activate the lower leg muscles while seated, especially after long periods of inactivity. Number 4 is the controlled seated leg extension. It strengthens the thighs that help you stand, climb steps, support your knees, and remain independent. Number 3 is the supported calf raise. It trains the calves, ankles, and feet while creating a strong upward muscular squeeze. Number 2 is the supported single leg stance. It challenges your foot, ankle, calf, hip, abdomen, and nervous system to keep you stable while one leg remains active. And number 1 is the standing calf pump hold. Rise slowly. Hold the top for 3 to 5 seconds. Keep breathing. Lower with control. That sustained hold is the small detail that turns an ordinary heel raise into a deliberate pumping exercise. Keep walking. Keep moving. But do not assume your step count tells the entire story. Your legs have carried you through decades of work, family responsibilities, travel, celebrations, losses, and ordinary days no one else remembers. They deserve attention before they begin to fail. A few focused minutes may help you protect strength, balance, confidence, and independence. Not because these movements are magical, but because they train the body to contract, stabilize, pump, and move. Tonight, when you sit down, do not allow your feet to remain completely still for hours. Lift your toes, raise your heels, feel your calves tighten. That small squeeze is your second heart waking up. Tomorrow, add the seated leg extensions. Then practice the supported calf raises. Then the balance holds. Finish with the slow calf pump hold. You do not need to become younger. You need to give the body you have today a reason to remain capable. Aging may change your muscles, but it does not erase their ability to respond. Strength can improve, balance can be trained, movement can become more confident, habits can change. The downward spiral is not the only direction available. Your next step does not need to be large, it only needs to be deliberate.